When to use radiography in young children with minor head injuries. Head injury is a common reason for children to visit emergency departments. Although termed minor, these head injuries may have complications such as skull fractures and brain injury. Computed tomography scans, which are the most effective diagnostic tool, carry an increased risk of radiation and cancer. Skull radiography carries a very small risk of cancer, costs less and creates less discomfort for children. Till now there is no consensus on how to treat children with head injury, who do not meet the criteria for CT imaging, but still be at risk of complications. Dr. Jocelyn Gravel, Department of Pediatrics, Centre Hospitalier Universitaire, Saint-Justine, University of Montreal, Canada with co-authors. Developed and tested a rule, to help emergency department physicians to identify children under age of 2 who are at risk. The Canadian developed rule is published in Canadian Medical Association Journal on September 8, 2015. Derivation and validation of a clinical decision rule to identify young children with skull fracture following isolated head trauma. Using the decision tool, the researchers identified approximately 90% of skull fractures in children with minor head injuries. The two predictors identified through recursive partitioning for the development of the rule were parietal or occipital swelling or hematoma and age less than 2 months. Use of the rule would have decreased the overall number of skull radiographs by about 60% in the study population. This clinical decision rule will have several outcomes. Better use of healthcare resources by avoiding unnecessary visits to emergency departments, improved care for children with head trauma, and improved ability of triage nurses to identify children at risk. Most important factor is the rule is simple. In children less than 2 years old with a minor head injury who do not meet the criteria for a CT scan, perform a skull radiograph if they are less than 2 months old or they have parietal or occipital swelling. Thank you.